Hi there, it's Dr. Donna. I have been wanting to give you guys an update on coronavirus, but things have been changing every day. But today, finally, I said I have to do an update because things are continuing to change and they will continue to change. But I wanted to just make sure that you all understood what's happening and where we're going so that you can be calm. I know right now you're hearing coronavirus everywhere. It's like, oh my gosh, it's crazy, okay? Calm down. When I panic, you panic. I'm not panicking, you don't panic, okay? It's going to be all right. So, a number of important things happened this week. A couple of days ago, the World Health Organization called the coronavirus a pandemic, okay? What does that mean? A pandemic means that the virus is spreading rapidly across the world. Now, they were very reluctant to call it a pandemic, but because so many different countries were still being very lax about trying to control the coronavirus from coming into their country and containing it within their countries, that the World Health Organization had to step in, call it a pandemic so that it would rise to the level of importance in the eyes of so many different countries around the world. It did not mean that we learned that coronavirus is necessarily any more virulent, but we do know that it has spread from original 4 or 5 different countries to now about 115 countries now are experiencing this virus. So because it's continuing to spread and it's spreading rapidly, and so many agencies and administrations in other countries are not taking it seriously, the World Health Organization deemed it a pandemic. Now, we have seen pandemics before. In the early 2000s, we had H1N1 or the swine flu. We've had influenza pandemics. So we've had pandemics before. We know how it works in terms of how viruses is spread. And we've learned a lot from the other pandemics. And so when you know better, you do better. So now here we are in 2020 dealing with the coronavirus, and we're taking measures and steps that we didn't take in early 2000 with the swine flu, and that we didn't take when the very first influenza outbreak, but we're taking now. And that's because, again, when you know better, you do better. So that's why it's a pandemic. That occurred a couple of days ago. That allowed other countries to cause COVID-19 to put it higher on their radar and allow them to do something to help contain the spread globally. All right. The second important thing that happened this week happened today. The President of the United States declared a state of emergency. Now, that state of emergency, again, doesn't mean that COVID is any more virulent, but what it does, it gives them political maneuvering so that he can release money into where it needs to go in order to help combat COVID-19 in the development of the vaccine and the development of the treatments, in allowing hospitals to have more protective gear for their healthcare workers like me, so that we are protected when we take care of people like you who come into the hospital with COVID-19. So those are 2 very important things that happen, and that's why they happened this week. All right. So what can you do, again, to help prevent yourself from getting COVID-19? Going back to the basics, it's the same thing that I discussed in my first video. Your number 1 defense is your body, your immune system. So take care of yourself. Get lots of rest. When you are tired or stressed, your immune system is weakened. That means if you're weakened immune system and someone around you coughs or sneezes, or you're in a place where COVID is sitting on a tabletop, it makes you more likely to get sick. So take care of yourself. Get lots of rest. Eat well, because if you eat poorly, again, that doesn't benefit your body, doesn't benefit your immune system, weakens your ability to fight off disease. So eat well. Get lots of exercise and drink lots of water. Make sure that you stay hydrated. Again, we're going to dab our coughs and dab our sneezes, even though my son says, that's not how you do the dab, Mom. It's close enough, right? You get what I'm saying. Dab your cough, dab your sneeze into your elbow. That's going to prevent your sneeze and the particles from going across the room, landing on furniture, landing on other people. Okay, that's how we're going to help to prevent the spread. So Now, with the closures of all of the schools that are happening in school systems across the country, just today, my children's school system closed for the next 2 to 3 weeks. So it's happening. All of us are being impacted by COVID-19. Schools closing. Professional organizations are no longer going to play their games. Cruise ships are canceling cruises. Airlines are canceling flights. We are all being impacted because we know that if we try to distance people, that it will help to contain the spread of the disease. And that's what we're attempting to do. Slow the spread, decrease the spread. That will prevent it from taking more lives, right? Yes, it is disruptive to our personal lives, our daily lives. But if you think about it, wouldn't you want some disruption to make sure that your family member is safe and healthy? So let's have a little grace during this time and understanding, yes, it's a pain, but let's all work together as a community to help each other out, recognizing that if I'm safe, then you're likely to be safe. Okay? All right. So let's talk about what you're doing with your social distancing. What does that mean? How does that differ between isolating and quarantining? Okay. So social distancing is a preventive measure to say, hey, let's not have a bunch of people together that can then allow, if one person is sick and doesn't know they're sick, they may not be doing it intentionally, but they will prevent them from spreading that disease. So why have 18,000 people in an arena that will then, someone is sick, someone has COVID-19, they find out a day later, now you've got 18,000 people who were exposed plus their families. It just is a trickle effect. So distance yourself into small groups, not into large major groupings. So that's what the social distancing is. It's different from isolation and it's different from self-quarantine. So quarantining and isolation is that when that person, we know that that person is sick and we're saying we're going to put this person away from other healthy people. That's what quarantine and self-isolation are. And those things are very different from the social distancing that we are now asking everyone to do. Again, in your social gatherings, if you are sick, if you are coughing, if you have a fever, if you have a runny nose, please try to stay away so that you don't impact other people. We know that COVID-19 is spread from people coughing, or sneezing, having a fever, and we know that some cases is because of not even having symptoms and it's still spreading. There's a lot for us to still know and understand about COVID-19. That's why it's so important to try these measures that we know already work from previous pandemics. And then we'll move on to developing the vaccine. Things are already in place to have a vaccine available probably as early as late April, maybe early May. We know that there are already some medications out there, some antiviral medications that are used that seem to have some promising results for treating COVID-19. And so there are things that are being developed and they're going to be developed quickly, again, because of this economic impact and because closures of schools and organizations and professional sports. So state of emergency declared, more money into the economy, more money into the manufacturing of drugs and vaccines so we can get a vaccine out quickly, that we can get treatment out quickly. All right, testing. This is the final thing that I want to talk about. So many people are concerned about the testing. So for the average person, you and me, I get a cough and runny nose. I don't need a COVID-19 test. Well, I do because I'm a doctor and I work in a hospital. But the average person wouldn't need a COVID-19 test. And let me tell you why. Because it doesn't change what I will do and how we will treat you as someone with COVID-19 if you're not sick enough to be hospitalized. So the testing for COVID-19 helps us to track the disease. It's surveillance to see how the disease is moving and in what pockets it's being moved in. But that doesn't help the average person. When you're sick, it won't help you if you have a positive COVID-19 test because we're going to treat you the exact same way. We're going to tell you the exact same things. Wash your hands 20 seconds, preferably with soap and water. If soap and water is not available, use your hand sanitizer, okay? Stop coughing and sneezing. Stay away from people coughing and sneezing. The recommendations are going to be the same. So it doesn't matter if you get tested for COVID-19 or not. If you are severely ill, and of course, if you're in the hospital, then of course it makes more sense for us to do the testing of COVID-19. So I don't want you to get wrapped up into this testing panic, okay? It's not going to change the person who has a mild case and a mild disease, but it will help you, of course, if you get sick enough to be hospitalized. So I hope this was helpful. I gave you a lot of information. I will come back and update you all regularly. But again, as things are changing and we learn more about this virus and about the disease, I will let you know what I know. I'm continuing to be on calls with the CDC and doing webinars, and I'm trying to get as much information for myself as I can so that I can share it with all of you. So please be kind to one another, take care of one another, take care of yourself, and I will update you again very soon. Be healthy. God bless.